targets to work on within psychosis and focus on worry, talk a little bit about a practical treatment strategy that came from this clinical trial, provide a little bit of a case example and a family component that goes with it. And then I want to introduce, just to add something maybe a little new, is some information from the compassion-focused therapy approach, CBT and compassion-focused therapy, mindfulness. There's some overlapping that occurs, and there's some, I think, some useful information there in terms of working with worry. So let me move on to the next slide. So Dan Freeman and their group in the UK and England did a series of studies looking at what are the most common maintaining factors of psychosis. What are the kinds of things that keep psychosis going or maybe add to it in some fashion? And if we could identify these things, kind of their idea is we can certainly work on things like voices and paranoia, but perhaps we can work on other common targets that if we saw some benefit would help with the psychosis as well. And so you can see in this particular slide, there's percentages next to each of the items. That's the percentage of folks with psychosis who also report this as a concern in their life. And at the top of that list is excessive worry, which is at 67%. So it's a fairly common occurrence within psychosis. Other common treatable targets would be things like anxious avoidance. That's the safety behaviors we often talk about. Reasoning biases are very common in psychosis. The things we talk about, jumping to conclusions, all or nothing thinking, that kind of stuff. Poor sleep, at least in 50% of folks with psychosis, and low self-esteem. And so again, the idea is when working with someone who experiences psychosis, certainly asking about other things that cause distress. Are there areas that you would also like to work on? And maybe folks aren't ready to work directly on perhaps a delusional belief. Okay, maybe there are some other things they'd be willing to work on. And the idea is working on those things can help with psychosis. So we're going to spotlight today on excessive worry. And this is something we can all relate to. All human beings at some point or other have experienced worry. Worry is both content and process. So it's both the idea, like I anticipate a threat in the sense that I'm worried about something. There's something at work or at home with a loved one, something like that, that I'm not, that I'm concerned about, or that's not resolved, or I'm afraid there's going to be a bad outcome. And if we break it down, it's often described as kind of a self-talk activity where we hash out endless adverse outcomes, a lot of what if questions, and it could relate to psychosis. What if the voices hurt me? What if this happens? What if that happens? Oh my gosh, it will be so bad. So there's this kind of looping process that happens. And when I give training, I often talk about, this is one of the ways that we can relate to voice hearing. For those of us that don't hear voices or don't hear voices all the time, we've all experienced worry and things that pop in there and they bother us, and that's like a voice, right? And so worry is a parallel sort of psychological experience that can kind of maybe help us understand voice hearing a little too. So anyway, just that's a little bit about worry. There are meta beliefs that go with worry, and that the idea there is that there are ideas that worrying or thinking about things over and over will keep me safe or will help me solve a problem. And so that sometimes keeps the idea like, yeah, I got to keep thinking about this until I ultimately resolve it, which keeps us going and going and going. And then there can also be a parallel meta belief that, oh my gosh, I'm worrying so much and I can't control it. Then I worry about worrying. And so then you can see how it feeds the loop. When is it a problem? Obviously, thinking through issues, trying to problem solve is a good thing, but worry becomes a problem really defined by frequency, distress, interference, like a lot of things. Once it goes beyond, I don't want to give a number, but like 30 minutes or whatever the case may be, the more we're dwelling and stuck on it, the more interference it causes, then that's where it becomes an issue. There are some mental strategies that accompany worry that are relatively unhelpful. We cover this a lot in our emotion regulation discussions. So suppression and avoidance, trying to push things away and not think about them. So sometimes the deal with worry is like, don't think about that, don't think about that, and actually sort of spirals it from there. Trying to reason with a worry thought sometimes adds fuel to it. Frantic distraction is another thing that can sometimes occur when worrying is happening. Behaviors that accompany worry can be reassurance seeking or excessive list making, and some of this can start to overlap into OCD kind of tendencies. But these are some of the behavior patterns, or individuals may use substances to dull the worry or the concern that they have. Same thing with psychosis or voices. As with all things CBT, we develop a maintenance formulation that goes with it. And this one is borrowed and adapted from Managing Your Worries. And by the way, there are little links throughout the PowerPoint and at the end that kind of link you to resources related to this. A lot of CBT therapists or theorists link uncertainty as one of the main factors that leads to worry. The idea that I have to know something for sure, or have to have it, to have certainty about something, is important to safety. And so when there is uncertainty, it can lead to worry, and then the belief that worry is helpful. And then it kind of spirals this whole action. We think about it over and over. We seek reassurance or maybe avoid things because of the worries. Some of those safety behaviors reduce the worry short term, but ultimately, especially the reassurance seeking kinds of behaviors, tend to just reinforce it over time. So how does this link into psychosis? In the study that Freeman did, what they looked at, or one of the studies that they did, they looked at the level of worry in individuals with persecutory delusions, and found that the level of worry was similar to generalized anxiety disorder. Secondly, they found a dose-response relationship between worry and paranoia, in the sense that kind of more worry, more distress related to paranoia, and that worry in itself was a predictor of the occurrence and persistence of non-clinical paranoia, and that levels of worry predicted persistence of persecutory delusion. So we have a little image where you have paranoia, and if you worry or sort of ruminate about it, it's sort of like adding fuel to the fire, and so the paranoia can kind of grow that way. So what to do about it? The Freeman study was called the Worry Intervention Trial, and what they did was target worry as part of what they were going to work on. And the idea, worry reduction strategies: if you can reduce worry, you could reduce paranoia. And so they had a fairly large sample, 143 individuals diagnosed schizophrenia with persecutory delusions and clinically significant levels of worry. Their intervention was a 6-session worry reduction CBT approach over 8 weeks. So it's very targeted. It was not a long-term therapy. It was very much the person wanted to work on this. This is what the trial is about. And they kind of focused on it, split the groups. And what they found was that individuals who received the CBT with the worry reduction parts both reduced worry and the measure of persecutory delusions, which in this study was the PSI-RATS. And the change in the worry scores when they did a mediational analysis accounted for the 66% of the change in delusions. All right, so the idea seemed to bear out. The thing they also mentioned in the study was it wasn't only reducing worry, it was also increasing activity level in areas of interest. So less worry, more activity in an area of interest, which kind of makes sense, right? So that implicitly challenges the persecutory delusion by doing those things. So what is the trial? And just to kind of have information about what was involved. So there was education involved, positive and negative beliefs about worry, increasing awareness. So working with the individual to monitor worry periods. So this could be an activity schedule or a worry diary. There's a couple of different ways that you can do it. And once they had that information, they formulated a worry cycle using the maintenance formulation approach, and then applied it to their life. And as far as the practical interventions, they did a couple of things. One was, the main thing that they did was taught individuals, besides the psychoeducation, to develop worry periods or worry postponement. And so the idea is that rather than worry throughout the day, 6-8 hours a day, schedule a time during the day, this half hour, nothing but worry. So 5 to 5:30, whenever it is, this is your worry time. And then at the other times throughout the day, we're going to teach you strategies to notice when the worry happens and remind yourself you have this worry period, and then help them to switch into some other kind of activity. And so they would teach things like mindfulness practice. They would also focus a bit on sleep hygiene if the worries were happening closer to the time of sleep, and kind of help them to find ways to move off of the worry. If there was a meta belief related to problem solving, then they would say, well, let's schedule a very specific thing on problem solving training and kind of set boundaries around it and show how that works to try to make that more effective. But the key skill in there was helping them to let go of the worry with those strategies. This is their worry postponement script. So you can go back and look at this in more detail later, but it's kind of understand the experience, normalize it, and then help them to schedule this worry time. And the understanding it was to develop the maintenance formulation, get a sense of how controllable it is, advantages, disadvantages, that kind of thing. Do a lot of normalizing, it's understandable that the stress comes from this. Quite common to think worrying helps, but let's look at how effective it really is, and then help them to consider another strategy, and that would be the worry time strategy, scheduling the worry time that I mentioned before. All right, so that's the basic framework. I'm going to just present just a little bit of information, a very short case example. This is a worry cycle that occurred for an individual, about a 30-year-old individual who had a lot of worries and voice hearing and paranoia. What we determined with this individual was that worry was activated most often when he made mistakes, misplaced something. He was very scattered, had other cognitive difficulties like ADHD and other kinds of things. So it would happen quite frequently, make mistakes, or being around authority, worry would get activated. There was some sort of threat. Am I doing this right? Am I going to get in trouble? And then one of the automatic thoughts would be, I've made these mistakes. The devil's doing this. And voices would say, you're bad, you're weak, you're guilty, those kinds of things. And that would sort of amplify. Then he would worry about it, that the emotional experience would be anxiety, shame, and paranoia. When we dug down into the meta beliefs, it was that, I've got to think about it. I've got to check with others to make sure it's okay. I don't want the devil to hurt me, those kinds of things. And then the behaviors, the way it got translated in actual behaviors, besides the dwelling on the negatives and ruminating, there was a lot of reassurance seeking, apologizing, and suppressing that was going on. So family was, always, I don't say bothered by repeated requests and apologies and things like that. And so this was the pattern that sort of unfolded in this particular case. So when we looked at it, and this was part of a much larger treatment, but some of the things that we tried that paralleled some of the work that Freeman did was we identified the worry cycle, just like I showed here. We talked a lot about what does it mean spending all this time on it. He used the word obsessing, and he really came to the conclusion that it really does make it worse. He spends way too much time dwelling on all these thoughts and trying to check with people, and just kind of normalize that a lot of people, when they have distress, they kind of get into these patterns because they think it's helpful, but it really does get in the way. And he was able to see that, and he bought in enough to the idea of, like, let's think about ways to schedule some worry time and maybe letting go of concerns. We attempted to schedule like very typical worry time. His cognitive makeup was such that he was not very organized, and setting schedules to do these things on his own was rather difficult. We tried to set schedules, try to get family to help a little bit, but it was tricky. So we opted for working on some of the worry times in session in kind of three parts. One was having opportunity to talk about the worry within a contained amount of time. So we'd set some time limits on it. The other piece that we would practice was ways to speak about the worries while doing something fun. So one of the things we did was we had a football. He liked football, and I would say a worry and throw the football to him. He'd say a worry, throw a football to me. And so we got some exposure to it with something a little bit fun, and just kind of got some practice doing it. And again, part of it setting time limits around it as well. And then to kind of concretize the idea of letting go of a worry, what we did to make it more concrete was to have a physical action. And so we had a different ball that we would use, and we would notice a worry that was of concern, kind of squeeze it, and then release it, roll the ball to the other person. So there was kind of a physical action of letting go to release the worry and pass it on. And so there were just some ways to try to teach the skill of notice and let go, and then try to set some boundaries around the worry that was happening, that was fueling the paranoia and the voice hearing. How we involved the family members, had one parent and one sibling that was very interested. There was a lot of reassurance seeking that was happening. So we had family sessions to coach the family in terms of things to respond when he would seek lots of reassurance. And it was really mostly about noticing, I'm wondering if this is reassurance seeking, to kind of help with this worry, guide him to kind of come to his own conclusion related to it, kind of help them guide him, rather than just saying, yes, it's okay, don't worry, that kind of a thing. And we also developed a routine that he liked. His one sibling was a pastor, and he was very faith-based. And so, and he liked to spend time with her. And reading little Bible verses. So we talked about and worked with the family around identifying a positive message, reflecting together, he and his sibling, about that, and just sort of reinforcing that positive view of self. And so, separate from a worry time, we created sort of a positive affirmation time. And this fits in with the compassion-focused therapy approach that I'm just going to briefly mention next. from a compassion-focused therapy standpoint, and this is Paul Gilbert is the main author on this. Many of you may be aware of his work, but one of the main ideas is that from an evolutionary standpoint, we develop mechanisms to regulate our emotions. And he identifies three main methods. One system has to do with threat and defense. And so this is finding signs of danger and what do you do with signs of danger? So this is fight or flight kinds of mechanisms. So adrenaline and cortisol and feelings or anxiety and anger and those kinds of things. So that's one emotion regulation system. The second is the drive system. And this is the system that motivates us to pursue things, you know, an evolutionary standpoint, food and shelter and working for success, those kinds of things. And dopamine is the neurotransmitter most associated with it, but it's about pursuit and achievement. And then the third system is the soothing system. And this was sort of built in to manage distress. It's there to promote bonding and safety. You know, people feel safe and contented when this system is more online, and the neurotransmitters involved are things like oxytocin, even some of the opiate systems, things like that. And so the idea is when things are working well, these three systems are balanced pretty well. However, in our common times, in particular with worry, what happens is the imbalance is something like this. The threat and self-protection system is way online, so it's very much amped up a lot of the time. And the drive excitement system is also acting up. So one way to think about this is that if I'm a person that's a people pleaser and I have a sense that somebody's angry with me, that's kind of perceived as a threat. So my threat self-protection system gets activated and may push my drive system to do something about it. But that person may not be around. I may not be able to talk with them at that point. And so there can be a lot of worry and rumination that happens at that time, and may also push me towards some of the appeasement and, you know, reassurance seeking kinds of behaviors. And what's notable in this system is that the soothing system is way offline. It's not balanced very well. So from a compassion focused therapy system or approach, you would talk with people about these different systems and just talk about that there's an imbalance. And often what can be helpful is help people to balance their systems by enhancing their calming or soothing system. And so you provide some education about this. And from the compassion-focused approach, there are skills, strategies, things that you can do to try to bring the calming and soothing system more online. So how to focus your attention in a way, value-based kind of way that brings on that calming and soothing system. Cultivating things like loving kindness, warmth, openness. What are the activities that generate those feelings within your body? How to notice those things, how to bring them online. Even things like body posture, facial expressions, things like that. Working with reasoning, you know, working in a traditional cognitive behavioral therapy way by reducing all or nothing thinking or some of those cognitive errors can also lower the threat system in a more kind of cognitive intellectual way. Imagery work can be used here, creating safe place imagery. And in the compassion-focused approach, they really talk about helping a person develop a compassionate picture of themselves, you know, seeing themselves as wise and calm and focused. And that brings that compassion system more online. Sensory grounding exercises, things like the 5-4-3-2-1 technique, you know, that, you know, I'm going to focus on your senses, 5 things that you can see, 4 things that you can feel, 3 things that you can smell, those kinds of things. So bringing yourself back to the sensory system, or in general, any kind of mindfulness work focused, you know, again, with psychosis, not lengthy, but focused mindfulness work, that non-judgmental awareness, and just sort of letting things go through, all work to sort of bring the calming system more online. So the idea there, and I'm working with a different client at this point, just specifically on this, just to try to help him lower his threat defense system is like 99% all the time. And so just trying to help him activate another part of the brain to bring some of that threat activation down a little bit so we can actually work on other things. So anyway, those are the main points that I wanted to make today. Just so you know, once you get the handouts, there's a whole section on the Freeman studies, the compassion-focused therapy, have some references. I also have some handouts on worry in case you're looking for any. You probably have a bunch of these anyway, but a few to look at. And I did a little bit of searching for stuff for family and caregivers. I really like the third one for excessive reassurance seeking, you know, for statements family members can give to their loved ones around this excessive reassurance seeking. So there's some helpful stuff there. And then the last slide I didn't include here as much was the one that talks more about the 3 systems again. Okay, so I'm going to pause here. Any questions